This is the video for Intro to CPT, Chapter 15, the Musculoskeletal System. If you start in the beginning of your chapter and follow along, you can pause me so you can get to that area if you need. They talk first about the format of the musculoskeletal system in the CPT book, and it says it is formatted by anatomic site, like general, and then head and neck. The first subheading in this subsection is general. It contains procedures that are applicable to many different anatomic sites. The other subheadings are further divided by anatomic site, procedure type, condition, and description. It usually includes, and they give us a good listing there, incision, excision, repair, reconstruction, fractures and dislocations are in this system, arthrocentesis, amputation. Any or all of these categories of procedures may be located under each subheading. The codes in the musculoskeletal system subsection are reported, it says extensively, of course, by people like orthopedic type doctors, orthopedic surgeons, to describe the services provided. But there are many codes out of this system as well that come from your regular family practice or primary care physicians. Splinting, casting, fracture codes, things like that. So it's not just that you are going to be working in orthopedics to do this type of coding. There's going to be lots of different areas that you might need to, dip into this for coding. Thorough review, of course, of the medical record, it says, will help you identify key information necessary for coding. Of course, they give us a little listing or tips to help us choose the most correct code, and these are really, really good. I want you to pay attention. I've got a 15-minute video. I need to get through the whole chapter. You needed to take more time and read through this on your own. Number 1, it says identify whether your procedure is being performed on soft tissue or bone. And it says many of your musculoskeletal system excision codes to report tumor excision are based on if the tumor is of the, number 1, the sub-Q or soft tissue tumor. So it's below the skin, because that would be a code that starts with a 1, right? From the integumentary system, the skin area. So this is below to just above the deep fascia. Then it says facial or subfacial tumors within or below the deep fascia, but not involving the bone. Radical resection of soft tumors, and they define that sub-Q or subfacial, but with wide margins, and radical resection of bone tumors. So careful reading of these guidelines, remember those green pages at the beginning, okay, are a must before reporting excision of tumors. Number 2, determine whether your treatment is for traumatic or a medical condition, so acute or chronic, okay? And they talk about diagnosis codes from Shelley's class, ICD-10-CM codes. Identify the most specific anatomic site. This is how remember we code to the highest specificity, okay? So, for example, it says when you're coding vertebral procedures, was it a cervical vertebrae, the thoracic vertebrae, lumbar vertebrae? Where were we at? Okay, that's going to help us. Number 4, determine whether the code description includes grafting or fixation. You can read about that. Turn the page. Number 5 and number 6. Read that code carefully to determine whether it describes a procedure that was on a single site, like each finger, for example. If the same procedure is performed on multiple sites or multiple fingers, do you need to indicate the number of units or list that code multiple times? And when you're doing homework, I hope that you know that if you need to report one code twice, you can do it a couple of ways. You can report that code twice, okay? Like it says, it gives us an example, 206 or 26060. You could write 26060, comma, 26060, okay, report it twice. You can report 26060 times 2, okay, x2. And that really is how we do it in the coding world. When we code on a system and we code from a work list. And it's very, I want to say, Excel-like, okay, in your mind. Excel, meaning Excel format looking, worksheet type looking, and it's very line item. And so if we put 26060, there's another column down here that says units, and you would put 2, meaning 2 units of 26060. So the times 2 is fine, or reporting it multiple times and writing that code out is fine too, if you ever have that with homework. And then number 6, check any medical terms you don't understand. It's time to take the time to do that now, because in advanced, it's time that you start knowing that stuff, okay? It needs to be up here. So the more time you take now, the better off you'll be. They give examples of fractures. They talk about fractures and dislocations, and some of these bold terms are really, really good here. I think the biggest things with fractures is we need to know, is it open treatment? Is it closed treatment? Okay, open treatment of a fracture, it says, is made when a surgery is performed. Your fracture is exposed, okay, to the naked eye by an incision made over that bone or that area, and then we fix it. Closed treatment is performed when the physician repairs your fracture without directly visualizing it. So there is no cut, okay, in through the skin to see the bone and set it. They can pull it straight, cast it straight, x-ray it to make sure that it's straight, and then, set it. On the next page, it talks about closed treatment with manipulation, with or without, and then with or without traction. Manipulation, they talk about there. That's good that you read through some of these definitions here. Again, I'm not going to take the time to go through all of them. Closed treatment without manipulation is discussed. I want you to make sure you read and understand that. Closed treatment with manipulation, and then open treatment. Now, fractures are divided at the very bottom of the page there, whether your fracture is pathological or whether it's traumatic. Now remember, pathological is there was no injury. It occurred in an area of weakness. And a lot of times we think age with this, but it doesn't always have to be age. It can be because of disease as well, or sickness. So a pathological fracture means I didn't fall, I didn't, hurt myself that way. I just did something normal and it broke, okay? I got up out of bed and I had this terrible pain, okay? I wasn't doing anything crazy, it just happened. Fracture codes are reported. They talk a little bit about I-10 here with a 7th character to indicate whether the care was initial or subsequent, and then open or closed. And those are very important things when we're finding our CPT code for the procedure as well. They go on the next page to talk about open, closed, percutaneous skeletal fixation. Okay, so using rods and pins and things like that. Traction, okay, they talk about as well, and you can see some pictures over there. The big thing is you need to make sure that you understand that there is not a relationship between open and closed, what type of fracture and what type of treatment. Does that make sense? There is no direct correlation between the type of fracture and the type of treatment. So here's what I mean by that. You don't, just because you have a closed fracture, meaning the bone isn't coming out of my skin, there's no blood, okay, but deformity. Just because you have a closed fracture doesn't mean you're going to have closed treatment, okay? You might have open treatment. So there is no correlation, there is no relation between the type of fracture and what type of treatment they're going to do, okay? That's assuming, and you know what happens when we assume, so we don't want to do that. Dislocations are talked about next. Again, a dislocation is a displacement of a bone from its original or natural spot or joint, okay? Let me see. If you look at exercise 15.1 about fractures and dislocations, just going through, these are good for you to do on your own. Again, you have the answers at the back of the textbook here. But just looking at number 1, it says nasal bone fracture, closed treatment. Where would I go first? I do a lot of underlining and number writing in Intro to CPT. And I underlined fracture, and I put a 1 because I would go to fracture first. And then I underlined nasal for nose, and I put a 2. That's the next thing I would find. And then I went to closed, and I underlined closed, and I put 3. Okay, that's the route that I would go to find that code. Does that make sense? Look at 4. Open distal fibula fracture repair with internal fixation. I would go to fracture first. Then I underlined fibula. It's the distal fibula. And it was open with internal fixation. Okay, that'd kind of be the route on how I would find my code. Okay, so hope that helps. Wound exploration is talked about next. We can read through those. It's just exploring and repairing the area of trauma that we might have. It talks about what it includes there in that first paragraph. That's a great paragraph for you to make sure that you pay attention to and highlight and make notes of. Excision again is super closely related to integumentary with musculoskeletal again. So this is musculoskeletal system. All of your codes will start with a 2. Okay, all of them. All of them will start with a 2. And integumentary, all of those codes started with a 1. Okay? In musculoskeletal, all of these codes start with a 2. So how do we know, they're very closely related. How do we know if we're in the integumentary system or musculoskeletal system? It's how deep you need to go. Okay? And it touched on that when we talked about the fascia area earlier. So the excision category, it says here are codes for biopsies of muscle and bone. The codes are divided based on the type of the biopsy. Is it muscle or is it bone? The depth of the biopsy. Is it superficial or deep? And in some codes, the method of obtaining the biopsy, like through a percutaneous needle. So we're deep into the muscle here. Deep into the fascia and the muscle areas when we're doing excisions from the musculoskeletal system. So that's something to pay attention to. How deep are we? Do my codes need to start with a 1 or does it need to start with a 2? General introduction or removal. If you look through this section, I kind of have the paragraph right before the coding shot highlighted. This could be removal of foreign body that's lodged in a muscle or tendon. Again, it has to be lodged very deeply. Okay, not just in the skin, because that would come from a 1. There's a removal of foreign body from the integumentary system as well. The coding shot, okay, is very important here. Make sure you read through that. Arthrocentesis is pretty popular if you're going to do any kind of clinic coding or outpatient coding. We do arthrocentesis a lot into the joints, and you can look at those common codes there. 20600 to 20611 in your CPT book. The area over that joint that, has an issue or trauma or injury or pain is anesthetized, and then a needle is inserted, and then fluid can be withdrawn. Arthrocentesis is talked about, the 206 codes here. It's not just withdrawing fluid, but it can also be putting medicine in. You can have excess fluid on the knee, and so we need to go in and withdraw some of that fluid. Okay, and that's it. That's the end of the procedure. But you could also have the next patient that has excess fluid on the knee, and we withdraw some fluid, and we put some cortisone in or steroid in. Okay, we also put medicine in. It's the same. Okay, it's injection and or aspiration. So make sure that you read those codes carefully here. If we turn to grafts or implants, you can read through that. We do more of that in advanced coding. Other procedures, bone grafts, flaps, electrical or ultrasound stimulation is listed here. Make sure you read through that on that page too. And really look at computer-assisted surgical navigation. We do more of that in advanced coding and watch some YouTube videos. But we talk about the stealth. Okay, the stealth bomber, using stealth navigation in healthcare for surgeries. We always code for that. It's an add-on code that we always will add if we use that technology. And I guess the way I explain it is it costs us a lot of money to have stealth at our facility. It costs us a lot of money to buy all of that technology to use it. So every time we use it, we need to charge for it. We need to try to recoup some of that money back. Okay, so that's something. It's always an add-on code. It's very expensive. We need to make sure that we charge extra for that. Fixation and instrumentation is talked about. Arthrodesis. repairs. Applications of casts and strappings are super important there at the bottom of page 403. Make sure you read that about what the difference between them are and what's included and when. Fracture repair, page 404, is a very important page for you to read as well. I'm going to stop here and make one short more video for you.